All right, good morning, everyone. Here to provide you an update on our COVID-19 activities with the City of Sioux Falls. I'm Jill Franken. I'm the Public Health Director in Sioux Falls, and a couple updates from me before I turn it over to some other folks that'll be providing an update for you. Yesterday, we held a special meeting of the City Council to regard Ordinance 2820. It is our no lingering ordinance, and that was approved by the City Council on March 26th, and that is set to expire next week. And so we have had a first reading yesterday of that ordinance to recommend extending that to April 22nd. And so that'll go to second reading next week for approval and adoption by the City Council. We've had really great compliance with that ordinance thus far. We're encouraged by the compliance of the general community. However, I will say that we're going to continue to be proactive in ensuring compliance, and so I'm grateful to our folks in the health department, our restaurant inspection professionals, and our law enforcement professionals for helping us make sure that everyone is doing their part to be social distancing right now. We are going to also continue to review our ordinances to make sure there aren't any other opportunities we should be taking, and we're continuing to have conversations ongoing to understand the direct impact or the projected impact to Sioux Falls as we continue to see our surge happen in our community. So we know that we have possible opportunity, but we are going to very carefully weigh what is in the best interest of our community moving forward. But thus far, we're feeling really good about the social distancing activities that we're seeing thus far. You'll also know, and I just want to remind everybody that the President also extended the coronavirus guidelines, 15-day guidelines, and actually to be a 30-day guideline to really run through the month of April. And so that's something that we all should be paying attention to and following as well. So before I bring the representatives from Avera and Sanford forward, I really want to comment on how much we are working together and how important that partnership is between Avera, Sanford, and the City of Sioux Falls and Public Health and our EOC to be working on a day-by-day basis, to be making decisions, to be making recommendations, to be looking forward as to what kind of impact we're going to see in our community and what we need to be doing now and in the near future to be impacting that to the benefit of our community. So with that, I'm going to turn it over to Dr. Dr. Elliott, I think, is going to go first from Avera McKinnon. So thanks, Dr. Wilde. Dr. Elliott.
Wow. Thanks, Jill. Good morning, everyone. Mike Elliott, Chief Medical Officer at Avera McKinnon. I guess to echo a little bit of what Jill said, I hope you know Avera is a tremendously proud partner with our state officials, with our folks from the City of Sioux Falls, with our regional healthcare partners. Glad that we are all, although 6 feet apart, locked arms in this effort. I do want to personally lift up Mayor Tenhaken and Jill, our Public Health Director. They're doing a wonderful job. Sleep well at night knowing we've got really good people working on this. We've talked a lot about the importance of flattening this curve, of trying to make this surge more manageable. And you all are probably really tired of hearing me talk about it, but I want to applaud your efforts. The social distancing we're doing, it is important. Please don't lose sight of that. Staying home if you have symptoms is critically important. I want you to know Avera is doing its part as well. We have enacted some visitor restrictions, and I know those are difficult, but again, it's our way of doing our part to help with the social distancing. We are screening all of our employees every day when they enter our facilities to make sure that they don't have signs or symptoms. We have gone to virtual meetings for just about every meeting we have. We continue to stress, both for our employees as well as the community in general, the importance of hand hygiene. I cannot stress enough how important that is. Avera McKinnon's Pharmacy, as a matter of fact, is creating our own hand gel. We know that hand sanitizer is in short supply, will continue to be in short supply. We've taken the proactive measure of creating our own for our institutions. We want you to know that even though as we prepare for this pandemic, we are still open for business. We are doing virtual visits wherever possible. Our Avera pharmacies have prescription delivery services. So please don't lose sight of that. Please don't lose sight of making sure that you're taking care of yourselves as we prepare for what's to come. We are dividing up as best we can ill visits from well visits within our clinics, trying to set up specific areas for respiratory symptom treatment. We are accepting, and I have to say, touched by the community outreach in terms of making masks for us. We are accepting donations of cloth masks, 3D printed masks, you name it. Our collection center is at our Avera Human Performance Center, and all are welcome, and your donations are much appreciated. While all of this effort is going on regarding flattening this curve, I also want to assure you that Avera is doing everything within its capability to prepare for this surge. We've seen the numbers in New York. We've heard the announcement from Dr. Fauci on a national level that there may be between 100 and 240,000 deaths in the United States. This is not falling on deaf ears. Avera very quickly in this process stopped all of our elective surgeries, both to enhance our capacity to care for people coming in with respiratory illness and to preserve our PPE, our masks, our gloves, gowns. We've already built capacity within our existing hospitals, McKinnon here in Sioux Falls and around our region, and have surge plans that will allow us to take an even larger volume of patients. Continuing to conserve the mask, gloves, gowns, as I suggested. Supply chain for Avera is working literally around the clock. We have orders in for everything from PPE to equipment to drugs. We know there's going to be a surge, and we are doing everything we can to prepare for it. We are looking at adding significantly more rooms on our main campus. We think it's important to try to centralize the experts, our specialists. We think that'll be a much more efficient way of taking care of patients than, say, opening up an off-site location. We're going to try to take care of people as close to our specialists and keep them confined as we can. Avera, as you know, has got a big footprint. We've got a lot of hospitals, clinics, physicians in our footprint, and we have a good line of sight across our entire region so that we can maximize our physicians and nurses, our equipment, the number of beds we have, the buildings that we have available to us. I know these last few weeks have not been easy for anyone. I'm touched by the efforts that have gone on here in the community, in our region. Even through this social distancing, I think in many ways we have come closer together. I want to encourage you to stay vigilant. Now is not a time to let your guard down. Don't take unnecessary risks. Take care of yourselves. Take care of your friends, families, and neighbors. If you need to go to the grocery store, think about picking up the phone of a friend or a neighbor that maybe isn't able to do that, or is one of those folks that falls into the high-risk age because of age or has a comorbid illness, and ask if you can pick a few things up for them while you're at the grocery store. I think as a community, we're going to do everything we can to come through this, so much appreciate those efforts. At this time, I will turn it over to my partner at Sanford, Dr. Wilde.
Good morning. Mike Wilde, Medical Officer at Sanford, and thank you, Dr. Elliott. Thank you, Jill. First off, as a representative of Sanford, certainly have been very touched by the outpouring of generosity from the community in regard to support of our staff, our healthcare providers on the front lines. In addition to, if you drive by Sanford, it's inspiring every morning to see decorated sidewalks, and it's truly amazing to see on a daily basis, so thank you. Thank you to law enforcement, firefighters, first responders, a wonderful gesture yesterday, coming to our Children's Castle and really uplifting the patients and the staff, caring for them in an excellent display, and the display last night within the city of Sioux Falls, and I know really kind of unified some neighborhoods, and really a neat event. As we prepare for what appears to be a surge of patients in this area, we at Sanford have been always planning on surge. And we've discussed this before and have communicated this as well, and certainly have been looking at this illness since January, and have made preparations and have been working literally around the clock as things get closer to us. We've identified areas where we can act now, and that is to stop non-urgent surgeries, to move patients rather than coming into the facility or being gathering in a social manner, but rather doing using technology as we have it in these days to reach out to patients where they are so they can be safe and isolated. We have taken measures, like I said, through the non-urgent surgery cessation to preserve our personal protective equipment and be ready to mount a response. We've worked closely with our outlying facilities in regard to plans and patient movements and working with their local plans as well. And I think it really raises a point while we're broadcasting from Sioux Falls and working in Sioux Falls, really we serve and have the honor to serve a region in a multi-state area. And we're unified against a common enemy. So you may be sitting in a small town saying this isn't going to hit us and this really doesn't apply, although there's been tremendous engagement. But the reality is, if each community has a couple of patients, it can rapidly turn into a significant vulnerability. And so we need the help of everyone as we try to flatten the curve, as Dr. Elliott pointed out. We've seen tremendous volunteerism within our staff, within our community, and that is much appreciated and accepted as it comes forward. We've had physicians, advanced practice providers, clinical staff asking, what can I do? We're doing more online type visits. We're not doing a lot otherwise. What can we do to help in these moments? And we are absolutely anticipating utilizing all resources as we anticipate surge. We continue to work daily. We continue to be very unified with our partners at Avera, along with the city and state resources. We thank you for your support and know that we are ready when the time comes. Thank you. And with that, I'll turn it over to Jill Franken.
So before I open it up for questions, it's evident the strong partnership that we enjoy with Sanford and Avera through the leadership of Dr. Elliott and Dr. Wilde to work with us and to help us to continue to be really thoughtful around what we are doing together as a community during this time period. And so I thank them so much. They have been really important members of Unified Command and part of the EOC. So with that, I'll turn it over to questions, and I'll just let you know that if there's anything that is pertinent for Mayor Tenhaken, he is in the EOC right now, and he said he could answer questions as well if they were necessary for him to do so. So with that, I can take any questions.
After looking at the latest data models, can you kind explain or describe what you anticipate this surge to look like in the hospitals?
Yes, the question is, based on data modeling, what is it expected for the surge to look like? And I think I would offer either Dr. Elliott or Dr. Wilde to respond to that.
Right. So thank you. So the surge obviously is a respiratory illness, really focused on respiratory and a small percentage with some heart issues as well. The surge, thanks to the cooperation of all of us in the community, based on the modeling, looks to still be a ways off. And by that I mean around another 2 to 4 weeks. And then the surge will not be a rapid peak, but thanks to everyone's great efforts, a flatter, sustained influx of patients that we, along with working with the resources like I alluded to, can meet, but it's going to require everyone playing a significant role in that. And it's what we've seen in other cities. There's no surprises from the care needed standpoint. It's really just a matter of when exactly it's going to hit and how long it's going to be. And that is really predictive things that all of us have participated in trying to do.
Public health predictive modeling. It's got some science to it. It's also got a little bit of art to it. I will tell you the models have some variation right now. Avera as well as Sanford, we are planning for the worst and hoping for the best. The models vary a little bit in terms of when it's going to hit, how high the spike is going to be, how long it's going to last. That's a little bit helpful, but to be honest, and I think I can speak for Sanford as well, certainly all of our health systems, we want to be ready before it hurts. And we want to be ready to take as many patients as we possibly can in a safe manner. And we've talked to our staff. We are in this for the long haul. I don't exactly know what that means. A year from now, I think we'll have a lot more answers than we've got right now. I know that's a vague answer to your question. I apologize for that. We're still working on bringing the different models together so that we have a real clear direction.
Jill, any comment on the governor's thought that this could last through July or August? The surge won't hit until then. Will we need to continue social distancing through then? Is she talking about preparedness for a surge as late as that time, or is there data suggesting it won't hit until that time?
The question is around the governor's projections of when we will see our surge and through what time period, indicating August, September timeframe. I'm not going to speak for the governor. I'm the public health director for the city of Sioux Falls. My responsibility is knowing where we're at as a city and what we think. And that's why we're really working closely with our partners that are in unified command so that we can do the predicting that we need to take the kind of actions we need to in our community. And then the governor has to make the determinations about what is happening, and Secretary Malzumreist, and as far as the state as a whole. And so that's what we're doing right now, is working closely with our partners here locally to understand Sioux Falls. A little bit of understanding what the impact might be of the state, knowing that a lot of those patients may come here, to these health systems locations in our community. But we are focused on what's happening in our community specifically and the actions we need to take. Both Dr. Elliott and Dr. Wilde talked about, possibly when that surge could happen, and maybe there's a little bit of variation. But it also impresses upon us that we have to continue to be thoughtful right now about what actions we need to take right now, And how long should we be taking those actions if we do take any additional actions? Or even the existing no lingering ordinance, how long should we extend that for? Because you've got to be as thoughtful about when you take action as when you need to let up on that action. Because this is going to be something we're going to be dealing with in some way, shape, or form based on waves that'll continue to, impact our community. Maybe not as great as this first wave, but still impact us. And so what kinds of actions and when and for how long do we need to be taking them? Those are things that we're working on right now.
I just didn't know if she was sharing her data with, especially the big cities in the state, to say, well, this could happen until then.
I can't speak to, the data itself. We haven't been presented that, data from a state perspective.